nation deploying a COVID-19 vaccine is actually part of our social development impact summit, which started 4 days ago, and we are at the end. And I have to tell you, in the 60 sessions which we had over the last days, with great public participation, the issue of COVID-19 vaccines, I think it came up practically in every session, because many of the issues we discussed are dependent on what progress we are making in the development and deployment of the vaccine.
So MSD is working on an oral antiviral that we're hoping will be relevant, and others are working on modalities including antibodies and other small molecule approaches. So,
well, there's a real mix of reasons, and some of it is frankly quite understandable. This is it's a brand new virus, and there's a lot of uncertainty around that itself. And if people aren't even believing that that's a real virus, why would you be caring about a vaccine? And the other part of it is that the information is uncertain. So we have to have a little bit of empathy with the people who say, I'm not sure. I think a lot of the surveys have put into their headlines overstated refusals, because they lump together those who really say, I would not take it, to those who say, I'm not sure, when in fact it's pretty reasonable to not be sure in the current environment. So, but there are, it's highly varied by country. What concerns me is that some of the countries that are starting to say they are not going to take it more, we've seen Nigeria, Pakistan, DRC was the least willing, and the knock-on effect it's having on some of the overall vaccine confidence. So I think that the good news is we have time. I just got data back from our EU study, a 15% increase in willingness and confidence in the flu vaccine. We're seeing, other confidence rising around pneumonia vaccine. Let's encourage the, people around things they know, they're familiar with, and in that interaction, start having a conversation about COVID.
Isn't one of the major concerns when it comes to the pickup of this vaccine is, as everyone has been brought up, is the phenomenal speed the vaccine will inevitably be brought online, and that has sparked a lot of concerns in people. So Julie, you who are involved in this, what could you do to reassure people that really safety checks, most countries are not going to neglect safety checks?
Yeah, I think people are concerned, and as Heidi said, it's a very understandable concern that in our race to get some additional population protection, that safety shortcuts will occur, and that is not the case. In fact, the major vaccine manufacturers signed a vaccine pledge just very recently promising that they would adhere to the safety requirements of the regulatory agents and not jump ahead of the curve in an effort to so-called win the race or get a product out there as quickly as the efficacy would allow. So I think we ourselves are self-policing and making sure that we don't overstep that confidence barrier. But there are a lot of other things that need to be done. And Heidi, thank you for bringing up the Ebola virus situation, because as MSD developed our now licensed Ebola vaccine and utilized it both in West Africa and the DRC, we learned so much ground truth about what happens in cultures that aren't used to investigational products or aren't used to new launches, and how much community engagement and local leadership really matters. But I think the opposite end of the spectrum is also true. We need to involve the really important opinion leaders, the trusted and credible doctors at the local level, as well as scientists more broadly, to first of all be informed of the actual facts, not the mythology or the political interpretation.
So I think if we look at what's happened, 20, 30 years ago, vaccine coverage was low. Today, it is quite high. It's the most widely distributed health intervention in the world. And we've introduced 496 new vaccines. Sai is right, most of those are pediatric vaccines, but we've also had vaccines for epidemic diseases, population-based, things like yellow fever, things like meningitis, and we've been able to do that. The way to do that, as Heidi has said so clearly, is engagement with the community, is having trusted spokespeople, is making sure there are facts available, but facts alone don't make this happen. What we really need is to also move with people's hearts, and that trust issue is absolutely critical. So it is doable, but it requires attention. The last thing I'll say is that, the alliance, it's not just the Gavi Secretariat, WHO, UNICEF, the World Bank, the CDC, all of these partners are going to work together with countries to help. And that work has already started. Toolkits have been built to help countries begin to plan for these vaccine rollouts and to understand what's going to be needed.
And as COVAX has achieved momentum, and even I would humbly suggest a sense of inevitability that this is going to be one of the very important mechanisms for delivering vaccine, we have more and more help to solve these practical logistical challenges.
And just very briefly now, how much of a blow is it for COVAX that big players like the China and US aren't on board? And are you any closer to persuading them to join?
Well, let me answer first, and then Seth can certainly jump in, and I think other colleagues may have valuable opinions to put in. But I mean, I think in many respects, it was not a surprise to us that, in particular, that the United States and China, because of their extensive internal domestic vaccine development efforts and their investments in vaccine development, might feel that they had a sufficient number of candidates that they would be able to account for the needs of their own populations. So may not view COVAX as a necessary delivery mechanism for their domestic needs. But there is also a way that these countries can continue and can still contribute to the global effort that COVAX is trying to lead, and would do so out of enlightened self-interest, because it will help end the pandemic sooner and help them restore their economies. And that's through contributing either funds or doses to support distribution, particularly to developing countries. And of course, they are contributing scientifically. I mean, we are working, some of the COVAX portfolio companies are based in the US, some are based in China, and we continue to have productive dialogues with scientists, in those countries, but also globally. So there are many ways that countries can contribute to the global effort. They don't all necessarily entail, buying doses for domestic use.
And then I was just actually then tacking on from what you were just saying, Sai, as an outside observer, I suppose, and when you look at COVAX, do you think there can be a conflict of interest? And I imagine maybe Seth and Richard will have something to say here, but that high-income countries who are developing their own vaccines in this kind of so-called, vaccine nationalism are also part of COVAX. Can the two work together?
I think they can work together, but it's a matter of the kind of product development they do, and it's a matter of kind of the delivery systems and the delivery mechanisms that companies have in mind. Because what may work for, let's say, US or Europe or China may or may not work in middle income and other low income countries. What worked, for example, for Ebola may not work for COVID-19 vaccines. I mean, if a vaccine has to be stored at extremely low temperatures, or if it has to be, for example, say lyophilized and to be having diluent to be carried along with it, then all of this adds to the burden of distribution, administration, biomedical waste disposal, all aspects of vaccines and vaccinations. And that WHO and UNICEF and Gavi and PAHO know very well about this. And it's not just the fact of making a vaccine, but you need to transport it with care. It has to be delivered with care. The biomedical waste has to be disposed. So there are many, many, many aspects of this. A simple concept of a vaccine vial monitor that is really required by WHO, that is an important marker of vaccine safety and quality at the point of use, is very important. If a company is not able to put that onto a vaccine, then it poses difficulties down the distribution chain. Biomedical
have continued investment. And the challenge in the past has been we invest, then we stop because, there's no longer an epidemic. This time, the cost has been somewhere between $9 and $12 trillion. I do hope what Julie said is right, is that people will now say, oh my God, a little bit of investment, a little bit of preparation during peacetime is exactly the right thing to do to make sure that we are prepared. And we can work with the new instruments we've built, but we will even need to build new ones, better surveillance systems, better understanding of disease, but we need to fund it in peacetime.